this is our blood draw. We've got our syringe and needle, alcohol swab, and then our lavender top tube and our green top tube. We're going to be running an adult chemistry panel on her today. I'm going to hold off the thoracic inlet, just kind of increase the blood pressure here, and just separate her hair because she has a lot. Use our alcohol swab to get the hair down. Cameo's gonna hold off with 3 fingers and make sure that clots well. Alright, and that's how you draw from the jugular vein. Okay, we're going to do our buccal mucosal bleeding time test, and we have our patient here and our spring-loaded lancet. So we're going to hold our lancet firmly to the tissue. Okay, made our incision, and we're going to start our timer. And every 5 seconds, we're going to blot just below that. And we want to be careful not to blot at the incision itself. So he clotted at about 3 minutes, which 1 to 5 minutes is normal clotting time. So. All right, we are going to perform the blood smear. So I've got my whole blood, and I've already labeled my slide with the patient's first and last name and then today's date. So I've got a clean pipette. I'm just going to put a small amount, small enough that it'll dry pretty quickly. We don't want a whole lot on the slide. Okay, and then we're going to hold the slide at a 30-degree angle, bring it back, let it spread a little bit, and then move forward just like that. That way we get that nice monolayer. I'm not sure if you can see that, but you get a nice feathered edge, you get the nice monolayer, and then you kind of have the rest of the cells there. So we're going to let this dry. Okay. And we have our staining clips, that way our hands stay clean and free. And we're going to do each of these stains for a minute. Just want to gently rinse this off with some sterile water. They do recommend washing off both sides, just very gently. Okay, and now that is stained and washed off gently with some sterile water, what we're going to do now is actually look at a prepared slide that I've already done, and so you can just kind of see that nice feathered edge here, as well as the monolayer right behind that. So we're going to take a look and look at this slide, and we're going to start on our lowest setting. And we're going to find that nice feathered edge like we were talking about. So we found the feathered edge. Now we want to continue to move up on the power or magnification. And we want to move back to that monolayer. And that's where we're going to be doing our actual cell count. And in the monolayer you can count the number of platelets for a high power field. You can also count your other white blood cells, monophils, neutrophils, basophils, eosinophils, and bands. You can also look at the red blood cell morphology, which can tell you a lot about your patient as well. So I'm going to put a drop of the immersion oil on the slide, and that way when we're looking in the highest power field, it will give us clarity of the cells here. And so here I can see a bunch of platelets and our red blood cells, which is beautiful. We can also see a lot of neutrophils on here. It's very rare that you see any basophils. I have not seen one yet. There are some band neutrophils in here. Some lymphocytes. And a couple of monophils in here. And there are quite a few of eosinophils. Okay, and that's how you read the blood smear. Okay, so we're going to perform our blood chemistry. We have chosen a chemistry panel. It includes some glucose. It also has some kidney values. It has a chloride, creatinine, sodium, total carbon dioxide, urea, nitrogen, some values like that. So we are going to come over here and grab a new clean pipette. I've got my labeled green top tube in here. We're going to pull up some of our blood, gently put it in the well, and then we're going to want to fill it to these little arrows on the side here that indicates that we have sufficient sample. Okay, then we're going to place our rotor on the machine, put our dirty pipette in the trash, put our lid back on this, and then we're going to hit close and enter our patient information. Okay, so we have a cat's blood here. Enter our patient number. His name is Fat Cat. Okay, and so that blood work is going to be running here for the next 15 minutes. So we're going to speed the video up, and once it's done, we'll show you the results. Alright, so our blood results look beautiful. Everything is nice and normal for him. No abnormal values. Okay, we're going to be performing the slide agglutination with saline. So we've got our saline here, and then we have our blood. We also have a little tube to go ahead and just gently mix the saline and our blood. We also have our pipette to draw up the blood, and then we have our 1 ml syringe to draw up 0.1 mLs of the sodium chloride. So we're going to do that first. And there's many different methods that you can use to do this test. You can mix just a couple drops of saline with your blood on the slide. This is just how I prefer to do it. And we're going to put our saline in the tube, ready to start to mix up. Going to get a single drop of our blood here. Okay. There you go. Got a drop of blood. Throw this away. And then close our tube top there. Close this. And then we're just going to gently invert this. Okay, and then we're going to get a clean pipette for our slide. And we're just going to want to gently put it on here. Okay. And we can put this together. Just gently, we can put that down. And we can move the slide around as well and see that there are no clumps forming. Usually we can do the agglutination test for a number of reasons. One of the most frequent ones we do this for, though, is immune-mediated hemolytic anemia. And so we can see that there are no platelets clumping on there. We're going to get our microscope cover slip and put it on there, and just microscopically make sure that there is no clumping. Make sure there's no auto-agglutination or any agglutination on here. And we're going to start with our lowest setting and continue from there. And then we're going to move up to our next power and continue to focus in on those cells. Rouleau can be normal for some pets. It's not necessarily a cause for concern, but we definitely don't want to see agglutination. That's not normal. Okay, so what I'm seeing right now is rouleau where the red blood cells are kind of stacked, but they're not clumping together like in a group, like you would see with grapes, things, that kind of image. So this looks nice and healthy. Alright, so now we're going to perform our packed cell volume and our total solids test. So we have a couple of really important items. We have something to help keep our hematocrit tubes safe while it's in the centrifuge. We also have the microhematocrit tube readers. We have a couple of different ones here. We have our blood, which is pulled in a syringe. It has no additive. And then we also have our putty here. And that way we can use the clay to plug up the other end when it's centrifuged. And then for our total solids, we've got these two items that we'll look at later. But take two of the hematocrit tubes. Just one at a time, gently fill it. And you want to make sure that your blood is not on the red line. Sometimes it can fill up too much. And then it'll be hard to see the little bubble that forms. Okay, and now we're going to pack it full of the clay. Just like this. Okay, so now we've got a sufficient amount of clay in there, and we're going to do the same to the other hematocrit tube. Now we're going to put it in our stat spin, our little rotor here for the microhematocrit tubes. Make sure that your microhematocrit tubes are opposite from one another. That way the centrifuge is balanced. And you also want your clay to the outside because when it centrifuges, it's going to push everything to the outside. Alright, so now we're going to come over here and we're going to place our stat spin here, and it's nice and secure. So what we're going to do is set it to the hematocrit setting and then start that. Our microhematocrit tubes have spun down. We'll go ahead and pull them out of the centrifuge here. And we're going to use our microhematocrit chart. And we want to make sure that the bottom edge of the hematocrit tube is just touching the red line with the 0% mark. We want to make sure that the when we slide the tube along the chart, we want to make sure that the meniscus of the plasma intersects at the 100% mark. So our meniscus is right here, so we actually might need to use a smaller chart, which I have on hand right here. So our packed cell volume reads at 48, which is normal. That's within our reference range. I'm going to check the second one just in case. Okay, and our second one measures right at 50, 50% for the packed cell volume. And now we're going to perform the total solids or total protein test. So what we do is we actually are going to make a little divot. Using a slide is usually a safer way to perform this. And what you do is you just kind of etch behind that blood into the section that has the plasma. And that way you make a nice little notch. And when you break the tube, it'll be safer as opposed to just breaking it without making the etch mark. It just makes it a little bit safer. Shards don't go everywhere. Okay. And now that we've made our little etched mark on there, we're going to just carefully break the tube away from our eyes. That way we don't get hurt. And then we're going to take this and just kind of dab it on there. Okay, and now we're going to close our cap and look up into the light to see what our total solids is. And we are at 7.5.